Early symptoms of skin cancer you can detect at home. Skin cancer is the most common form of cancer worldwide. But the good news is that early detection can significantly increase the chances of successful treatment. One of the earliest and most important warning signs is a new mole or growth that appears on your skin. While not every mole is cancerous, any new growth, especially one that looks unusual, warrants attention. Melanoma, the deadliest form of skin cancer, often begins as a new mole or dark spot that wasn't there before. Existing moles or freckles can also change over time, and these changes might indicate cancer. Dermatologists recommend following the ABCDE rule when examining moles. A stands for asymmetry. If one half of a mole doesn't match the other half, it could be a red flag. B stands for border. Watch for moles with irregular, scalloped, or poorly defined edges. C stands for color. Be cautious of moles with multiple colors or uneven pigmentation, such as shades of brown, black, red, or even blue. D stands for diameter. A mole larger than 6 millimeters, about the size of a pencil eraser, should be monitored. E stands for evolving. Any mole or spot that changes in size, shape, or color over time should be checked by a doctor. Apart from moles, skin cancer can also appear as sores that don't heal, particularly if they last for more than a few weeks. Basal cell carcinoma, the most common type of skin cancer, often manifests as open sores that crust over, heal slightly, and then reopen. Red or pink patches of skin that are scaly, itchy, or irritated can also be early signs of squamous cell carcinoma. These patches might resemble a rash, but don't go away with usual treatments. If a patch persists or worsens, it's worth investigating. Another warning sign to look for is shiny or pearly bumps, which are often associated with basal cell carcinoma. These bumps can appear translucent and may have visible blood vessels beneath the skin. Skin cancer isn't always limited to flat patches or moles. It can also present as a lump or raised area. These growths might be firm to the touch and can sometimes bleed or ooze. Pay attention to any itching, tenderness, or pain in a specific area of your skin. While these sensations are not always linked to cancer, they can indicate that something abnormal is occurring. Dark streaks under the nails are another unusual but important symptom to note. This could be a sign of melanoma, particularly if the streak doesn't grow out with the nail or appears suddenly. If you notice a waxy or scar-like area on your skin, even if it's smooth and doesn't look like a typical mole, it could also be a sign of basal cell carcinoma. These subtle changes are often mistaken for harmless scars, but should not be overlooked. Skin cancer can appear anywhere on your body, but certain areas are more commonly affected. For example, melanoma often appears on sun-exposed areas like the face, neck, arms, and legs, but it can also occur in less obvious places, such as the soles of the feet, under the nails, or even on the scalp. Performing regular self-examinations is crucial for early detection. Use a mirror to check your entire body, including hard-to-see areas like your back and behind your ears. Take note of any new spots or changes to existing ones, and keep a record with photos to track their evolution over time. Risk factors such as fair skin, excessive sun exposure, a history of sunburns, or a family history of skin cancer increase your likelihood of developing the disease. If you fall into these categories, be extra vigilant about monitoring your skin. While self-checks are essential, they're not a substitute for professional evaluations. Dermatologists recommend annual skin exams for everyone, especially those with high risk factors. If you notice any suspicious changes, schedule an appointment immediately. Don't ignore changes to your skin. Early detection could save your life.